I'm Heather Ellsworth, licensed acupuncturist. Acupuncture as preparation for birth. There are many common complaints during pregnancy that can be relieved with Chinese medicine and acupuncture. The third trimester is an especially important time for treatment because acupuncture as preparation for birth can have a profoundly positive effect on the woman's labor experience. There are three main goals for treatment as preparation for birth. First, supporting the woman's constitution. Second, promoting optimal fetal positioning. And lastly, pre-birth acupuncture protocols for efficient labor. What do I mean by supporting the woman's constitution? Chinese medicine is a holistic approach because it treats the mind, body, and spirit of each individual through treating their unique differential diagnosis. I do this by listening to the patient's symptoms, checking their pulse, and looking at their tongue. This gives me their diagnosis. Each patient will have their own individual constitutional strengths and weaknesses. It's my job to treat the whole person to prepare her for labor. I want to make sure she is strong enough and has the energy for the journey ahead. I also treat any pain she may be experiencing in her third trimester that may make it harder for her during labor if left untreated. Many women may feel some anxiety about the labor ahead, and I use acupuncture to help calm their minds and prepare them for the journey. The second goal in preparation for birth is to support optimal fetal positioning. In the case of a breech presentation, it's ideal for a woman to come in for an acupuncture and moxibustion treatment around 34 weeks. An ancient empirical treatment for breech presentation involves the use of moxibustion. Moxibustion is a Chinese herb that's rolled into a cigar shape and burned over a specific acupoint on the toe. There are also acupuncture points used for helping to change the position of a posterior baby. These techniques are simple, non-invasive, and can be quite effective. Optimal fetal positioning can reduce back pain during labor and increase the efficiency of contractions. There's been interesting research on the use of a standard set of pre-birth acupuncture points as a protocol to help a woman's body prepare for labor and birth. There's an emphasis on preparing the cervix and pelvis for labor. This is a standard set of acupuncture points used weekly from 36 weeks on. This protocol has been shown to shorten the duration of labor in patients receiving treatment. It's important to note that practitioners of Chinese medicine will always use these point protocols as part of a treatment that also addresses the patient's constitutional diagnosis and particular needs. Another use for pre-birth acupuncture is aiding in cervical ripening. If a woman has reached 38 to 40 weeks and she and her primary care practitioner want to begin preparing the cervix for labor, we will begin cervical ripening. Should she become overdue, an induction with acupuncture or even a medical induction with her primary care practitioner will be more effective if she's received acupuncture for cervical ripening prior to the induction.